Hi, this is Dr. Yoon Kim. I am an integrative medicine and functional medicine physician specializing in LDN therapy. I have probably about more than 20 years of using LDN, and I would say it's one of the pillars of helping people in my practice. So, today's topic is going to be optimal starting dose and how do I increase the dose and what do I do if it doesn't work? What do I do if um, about side effects? So, let me talk about the optimal dose. So, idea is that there's optimal dose and that if it worked for another person, it must work for me. And I think that's not true. You have to look at the individual. It is the individual endorphin level. Is that person have a healthy level of endorphin? And that's correlated to um, functional functional status of the person. So if the person has a good job or decent job and is able to do the job or do a good job and has leftover energy at night, and also when they get up, they have energy to go about. Those people, I would say, endorphin intact, and those people can probably start from zero point 0.5 milligram, maybe even higher. If that person cannot and will not um, tolerate it, then you have to start asking other questions such as are you sensitive to medications, and how long have you been sick? What's your functionality? So if the worst comes to worst, I think that person is really compromised in terms of functionality, and that I have a feeling that their level of functionality is not very high, and that they're very medication sensitive. I may start them on 1 microgram, even lower, because there are ways that they can dilute it at home. So they can do microgram, they can do nanogram, and I just think that they need to have control of the starting dose, and they cannot have bad experience. If they do have a bad experience, I think it gets hard for them to uh, continue. So optimum starting dose has to be correlated with the notion of what happens to that person in terms of functionality, endorphin reserve, and how long have they been sick. Once you determine that, I think the right dose is the lowest dose. That I don't want them to feel anything in the beginning. I don't have idea that they should get. I just want them to tolerate the medication. Part of that is that I've seen so many people. I started this when everyone thought that 1.5 milligram was a great idea. I was one of the people who advocated for zero point 0.5. Now I start everyone on zero point 0.1, um, unless I think that they are compromised. And I start with 1 microgram and then dilute it if they don't tolerate that. And there are people who don't even tolerate nanogram, picogram. So it's it's a thing. And then so the second question is, how do I increase the dose? I leave that to patients, because it's individualized again. So I tell them, if you take in one, maybe take two. If two, you cannot do two, stay on one. Maybe 1 week, try again. If 1 week is not enough, maybe 2 weeks, and slowly build up um, the tolerance to LDN. So the other part is that it doesn't work. Well, you don't know the dose. So there are two ways that I look at LDN. One is an autoimmune condition. Autoimmune condition, the dosing can be low, dosing can be medium, dosing can be higher. So in my clinic, I will start as low as 1 microgram if I think they're endorphin depleted, and I'll push it all the way to 25 milligrams. In time, we're talking about every week increasing it if they tolerate it, and I increase it from let's say they start from 1 microgram, then second week 2 microgram, third week 3 microgram, and then I increase that to maybe 5 microgram, 10 microgram, 15 microgram. You get the idea. And usually towards the end, they don't have issues. If they have issues, then I ask them to stop it for 7 days and then restart at the low dose or lowest dose, and then start it, but go up very, very, very slowly. So the next question is, what do I do if it doesn't work? Well, LDN, I said, is an important pillar. I didn't say it's the only pillar that I use. So my frame of reference, I do integrative and functional medicine. That means that there's lifestyle, there is methylene blue, there's rapamycin. So I think it's a mistake to say that LDN works for everybody at this magical dose, and this is the only way, the right way of doing it. I think that's not the way it works, at least the 20 years I've seen it. It is highly individualized, and individualizing the treatment, I think, minimizes the possibility of side effect. And if it doesn't work, then you have to reset. Reset takes about 7 days, but some people longer. And I think you need to find yourself a prescriber who knows what they're doing. These days, I think you can get anyone with prescription authority to write you LDN. If you're simple and your case is simple, that works. If it's not simple, then you need to find someone like me in your community or in your licensure. So for me, I do have a telemedicine practice. I'll fully disclose, I'm not trying to get more patients, but I do have a telemedicine practice. I serve Illinois, Missouri, Texas, Florida, Georgia, and hopefully soon Iowa. And I do that because I find that expertise in LDN, anyone can write for it that has a prescriptive authority, but not everyone knows what they're doing. So what happens is that patients that come to me are usually very complex patients, or patients who want to make sure that they're getting the best care they can. So I know people are writing me, I know people are asking me. It's a little bit tricky ground because Facebook doesn't want us to practice medicine in Facebook. So if you post something, it gets spammed, I delete it. And when I have the time, I will edit it and repost it. If you send me messages directly, I notice that I'm not allowed to accept it or reply to it. I can call you guys, but again, dependent on my time. So what I'm going to ask everyone to do is please, please, please use the video and look through the videos I have, because most the answer is there. And blog is different. Blog is just factual, it's references, and I don't talk about things that I do in the video because I just don't know about YouTube. And so in video, everything is sanitized. It's evidence-based, and it's got references so that they can't say that I'm giving any kind of advice. So the advice I would give is find someone, a prescriber, what they know what they're doing. All right, everyone, have a great weekend. Take care. Bye-bye.